In 2023, 85% of women are complaining of menopausal symptoms. 10.5% are receiving treatment or therapy. I mean, it would be as if your testicles shriveled up and died at 51. That's the equivalent.
Let's get started.
Dr. Mary Claire Haver,
renowned menopause expert
with more than 2 million followers,
helping countless women through their menopause experiences.
Menopause is inevitable, suffering is not. But a woman is more likely to be prescribed an antidepressant for her menopause than hormone therapy. Women by the thousands are like, oh my God, I had no idea. That's when I realized no one's talking about this. So here's their laundry list of symptoms. We've categorized about 70. So there's brain fog, changes in her sexual function, weight gain. But here's the scary things, and the studies have been done. We see either a new onset or worsening of depression, anxiety, bipolar, ADHD, risk for cardiovascular disease and diabetes increases, recurrent urinary tract infections, which is a major cause of death for women. They're suffering in silence. And I was one of those women. I want to see my grandkids one day. I want to watch these women I've raised grow up and, be the women they're meant to be. And that choice might get taken away from me if I'm not careful. But there's lots of things that we can do. For example, we see a dramatic loss of muscle mass. Focus on strength training. This is going to determine your longevity as you age. Strength over skinny.
And what about your diet?
I developed a program for my patients, and it's not rocket science. It's